This chapter is on how microorganisms can cause disease. One of the overarching themes that we'll be talking about in this chapter is the difference between pathogenicity and virulence. So, we'll be talking quite a bit about that. There's also quite a few definitions in this chapter as well. So, starting off with some of those definitions. A pathogen is any agent that causes disease. Now, one of the things that I said in the beginning of the semester, we have lots of bacteria on us and in us. Fortunately, not a lot of them are pathogenic, meaning that they can cause disease. In fact, many actually do a lot of good for us. So, symbiosis is basically an association between two or more species. We just finished parasitology. So, we know with parasitism, one organism benefits and the other one is harmed, as we saw with many of those parasites like the protozoans, like malaria, and helminths, like worms. Many of the bacteria on us and in us actually benefit us. So we have sort of a mutualistic relationship with those bacteria. So we give the bacteria a home and resources, and they can do some things for us like outcompete bad pathogenic bacteria. So if they are taking up space and resources, there's not going to be space and resource for those pathogens to move in. They can also help us with making hormones and making certain vitamins like vitamin K. So, our bacteria in our gut and in our body and on our body can actually do a lot of good for us. So, there's also some other definitions along with this chapter. So, one thing we've been working to prevent in lab is contamination. So, especially if in manufacturing you have a sterile product, you want to make sure that it's not contaminated. So, we've been doing a lot of work in lab trying to prevent that contamination. We just finished talking about parasites. So, if we're talking about parasites, we might be talking about an infection, something like insects. We might be talking about an infestation. With microorganisms like bacteria, we mainly talk about infections and diseases. So, disease is going to be that imbalance of homeostasis and the disturbance of our health where we can't function as we should. So, in this chapter, we will talk about the difference between pathogenicity and virulence. Pathogenicity means that the organism has the capacity to cause disease. Virulence has to do with the intensity. So, how dangerous is that microorganism? We know that this can vary among types of organisms, so there can be certain strains. We have a lot of E. coli in our gut, but we also know that there are strains of E. coli that cause some very serious illnesses. We also know that virulence can increase as it goes through populations. So microorganisms get better and better at doing their job. It can also weaken as well. So here's a term. This is the first time that we will actually be hearing this. We'll talk about this a little later on with vaccines. Anytime that you hear the word attenuation, just think of decreasing. So, virulence can actually decrease by attenuation. So, for example, if there is a pathogen and it is taking hold of a particular species, if it then is passed on to a different species, now it's going to become adapted to that species and causing disease. So if it were to go back to that original species, it would not have the same effect. So sometimes it can actually be weakened. So anytime that you hear that term attenuation, just think weakened. So, as I said, we have a lot of bacteria on us and in us. This is what we consider to be our resident microflora. So we have bacteria, microflora on our skin, we have it on our mucous membranes, especially in our intestinal tract, urogenital tract as well. Places that we don't have microorganisms, and we certainly don't want them there, that would be our blood, our nervous system. And because of the harsh environment of the stomach, that very low pH, there's not a lot that will actually live in our stomach. Oftentimes, depending on what is going on with us, we could have transient microflora. So maybe under certain conditions, we might have certain microflora. So I was talking about ringworm in parasitology and how my daughter ended up with a ringworm infection. So all conditions were right. She had moist, warm skin that allowed that fungus to actually flourish. So sometimes, depending on what's going on with the body, we can have transient microflora. Bacteria are opportunistic. So, given the chance to move into a place where there's resources and space, then they're going to take advantage of that. So, for example, if we have a lot of E. coli in our gut, in our large intestine, if it gets into the urinary tract, it's normally not there, but given the chance, it's going to take hold. Oftentimes, if people are immunocompromised, now bacteria are going to get the chance to flourish and they're going to continue to grow. So, how is it that people can become immunocompromised? Well, as we get older and the warranty starts to run out, our immune system doesn't work as well. So, as we get older, we become a little more immunocompromised. If people are exposed to radiation or maybe some immunosuppressant drugs, or perhaps something like AIDS, where their immune system is depleted. The other thing that can cause people to be immunocompromised is malnutrition. So, if people aren't getting the nutrients, the vitamins that they need, now they're going to be at a disadvantage. So, one of the things that I often talk about is my husband has Crohn's, and he's been diagnosed for several years now with Crohn's. It took actually a couple of years for them to diagnose him. He's had to have a couple of surgeries where the inflammation was so bad in his small intestine, he actually had to have it resectioned. So, in both of these times, he ended up losing a lot of weight because there was so much inflammation. His body just wasn't able to absorb a lot of the nutrients. So, in both situations, he ended up losing quite a bit of weight, like 100 pounds. His diet, because he could not get the nutrients in, he was actually malnourished. So, before he had the surgery, because he was so immunocompromised and malnourished, they did not think that he was going to have a good chance to do well with the surgery. So he actually had to get his nutrients by way of IV. So if you've ever seen those TPN bags, kind of look like these huge, like 5-gallon milk bags because they actually inject the lipids in there. That's how he got his nutrition for several weeks to basically build that up so that his immune system could recover, and so he had a fighting chance from making it through the surgery and not having bad infections. I always thought that it was interesting during this time that he was on this IV nutrition. He was very obsessed with food TV. He used to watch food TV all the time, and I thought, this has got to be torture. You can't eat. But he was just obsessed with it. And that's how he was getting his nutrients. So bacteria are opportunistic. So given the chance to move in, they will. If people are on a long regimen of antibiotics, now we're not only killing the pathogenic bacteria, but now we're getting rid of the good bacteria. So now there could be space for bacteria, pathogenic bacteria to move in and take hold. And that's when people can get those super infections. So, given the chance, bacteria, they're going to move right in. So, as I've said with these chapters, there's many definitions. Of course, you can read these definitions, and many are going to sound very familiar to you. You're going to be familiar with some of these diseases. The two that I like to point out at the end, so the last two here, because they are I words, and you know that I like my letter associations, but sometimes those letter associations can kind of play against me. So, what's the difference between iatrogenic and idiopathic? So, they're both I words. Iatrogenic, this is caused by medical treatments or what we call nosocomial infections. We're going to be talking more about nosocomial infections and how we can prevent those. So, this is when a patient goes in to get treated to some medical facility, maybe a hospital. And then because they are possibly immunocompromised, they end up with another illness. So, for example, somebody needs a catheter, and then E. coli was actually transmitted by way of that catheter. Now they have a UTI. Somebody had surgery, and now they have an infection at that surgical site. Idiopathic, this is of unknown cause. So they're not completely sure what's causing it. So I often think of, it sounds like idiot to me. So I think of, oh, I'm such an idiot. I have no idea what's causing this. So since these are both I definitions, I words, I do like to kind of point those out just so that you don't fall for the same letter pitfalls as I do. So, how is it that diseases are spread? So, a communicable infectious disease means that it's spread from one host to another. So, the common cold, so that's going from one host to another. COVID, that would be a communicable infectious disease. A contagious disease, this is going to be highly communicable. So, again, COVID could fall under this, rubella, flu. A non communicable infectious disease means that it can't be spread from one host to another. So, this could be caused by an individual's microflora. So, for example, somebody having E. coli introduced to their urinary tract system. Now they've got a UTI. So, if you have somebody in your family with a UTI, it's not like you can catch that UTI. Perhaps somebody ingested microbes or microbial toxins that made them sick. That's not something like if somebody got food poisoning, you could not contract it from them. Or maybe some sort of infection from the environment. So I mentioned cellulitis before that I had gotten from a bug bite. And it just kind of blew up to be this big infection that I had to go on antibiotics for. So that was introduced by whatever insect bit me, and then the microbes moved into that open area. That's not like something that my family could actually catch from me. They could not catch that cellulitis. So communicable infectious diseases can be spread from one person to another. Non-communicable infectious diseases are not. So this can be caused by a variety of reasons. If you remember way back in the early chapters, we talked about Legionnaire's disease. This is something that people were exposed to in the environment. So it's not like they could pass it from person to person. We're going to continue talking more about diseases and a little bit more on virulence and pathogenicity.